morning. I am meeting you after many months. Last 1.5 years, we went through two waves of COVID. From March to December, the first wave, which was very mild, and now the second wave started in April and went on till June middle. So I think the second wave was really very surprisingly, it came very fast, and also it was very virulent. The virus was. So the disease epidemiology totally changed because of the change in the COVID viral strain. So that is the Delta strain of virus was seen during the second wave, which caused all this morbidity and mortality among the patients. So there was a drastic reduction in the incubation period and also the treatment response time in the second wave. So doctors had a very little time to react and treat the patients, and even patients before reaching the hospital only they became hypoxic with the reduced oxygen level. So many patients came to hospital with moderate to severe condition with oxygen levels of less than 90. So all of them were required either external oxygen or require ventilation admission for a long time. Added to that, even the effect for the remdesivir also was not found during the second wave, again maybe due to the different kind of a virus strain. So this all added to the total morbidity and mortality, and many families suffered because the first wave was not so serious. There was a time of about 7 to 15 days even after the infection for a patient to report to the hospital and doctor to treat, and many patients recovered without any complication. But second wave was different. So within 4 to 5 days the patient has to be treated, otherwise they go into hypoxic stage and severe lung damage, and that is the second wave. Now talking about the third wave, definitely I have also been of the same opinion that looking at the resistance status of the population and the massive vaccination happening. So in India already we are covered more than 100 crore of vaccine doses have been given. So all the high risk population, aged population has been covered with 2 doses, and the younger population between 12 to 18 years and below 12 years, though they are not covered with vaccination, they have been exposed to the subclinical infection, and a survey has already shown that the age group of 2 to 18 years has been done. In that group also there is already 60 to 70% of them already developed resistance to the coronavirus. So there's nothing to worry, or there is no apprehension about children getting severe COVID disease. So now government, based on that epidemiological input, government has slowly opening up the schools and colleges also. So many of our children are already resistant to corona, so parents need not worry about that. But still we have to maintain a guard against the corona, that is following the guidelines, wearing mask regularly when you are outside, and also sanitizing the hand, and avoid the crowd as far as possible. Now the winter season has started. The other problems have increased. Other kinds of fever, viral fevers, respiratory infections have started, and along with the dengue also had a very huge numbers in the last 2 months. So it is less corona and other seasonal diseases now. So but still we have to keep our watch against the corona, because last few weeks we are seeing little number of more cases, COVID cases are coming to our hospital, maybe in only 1 digit number, not even crossing 2 digits. So, but it is compared to the last few months, now it is a little higher corona cases are coming, but they are all mild and moderate cases are coming. No, we are not admitting them, they are getting tested, and they are vaccinated patients who are getting infected. So mild infection. So with 3 to 5 days of outpatient treatment, they are improving. So just we have to watch for another 2 to 3 months, maybe till January, February. So definitely there will not be any third wave looking at the present scenario. And also people talking about the third booster dose and all, that is clearly ruled out. The first 2 doses itself is more than enough to create enough immunity in our body. So after the second dose, antibody level need not remain high forever, because after 15 days to 1 month, after reaching the maximum within 3 months, the antibody levels will fall to minimum level in our body, but there will be some amount of antibodies in our blood. And there are something called memory cells which are get sensitized after the second wave of vaccination. So they will be guarding our body. As soon as any virus enters our nose or throat, immediately these memory cells, which are the part of the immune cells, get activated, and they will send a signal to release more antibodies, and these antibodies will come and attack the virus which are when they are in the nasal area or in the throat, and so that they prevent the spread of this virus into the lungs, and so not much of a lung pathology or lung damage will be observed. So 2 doses are enough, no third dose is required, and that is the message as regards the third wave. So parents need not be apprehensive about their children, and they should be taking precaution. That is more than enough. But to take precautions against the seasonal diseases, so provide hot water, keep the children in a warm clothes. That will avoid other viral infections, the respiratory infections. And coming to the VSGH, the changes and developments took a little backseat because of this COVID first and second wave. Now after the second wave is over, we have concentrated on providing more and more facilities in the VSGH. So we have done away with the slot registration for the general OPD patients, because there used to be some 600 to 700 patients every day waiting for registration, slot registration, going to the doctor. We have taken away that. Now the patients can directly go to the whichever doctor they want who is available in the OPD. And you can also see there are the nameplates put on the consultation rooms of each general duty medical officers whom you have to consult. But for specialists, that system of taking slot continues. You have to take a slot for the concerned specialist and concerned doctor, and accordingly you have to take the treatment. So that is one thing. And also we are trying to improve the other facilities in the lab also, and the waiting period for the patients we are trying to bring it down to minimum, and we are doing a lot of improvements in the casualty areas also. We are trying to bring out an help center near the casualty, or what you call a single window system in casualty. That is we have started, where all the registration and all the ward related registration, issue of birth, the death certificate, collection of charges for non-entitled patients, information about the doctors, services, everything will be provided there for those who are coming during odd hours into the casualty. So that will be useful for the patients, that how to get the service in odd hours when the general OPD has been closed. So that we have initiated, and also we have taken up a little maintenance of all the hospital infrastructure, whether it is furniture or it is the civil work or water supply. So all that is being done, because our hospital is a 30-year-old hospital. Lot of wear and tear is happened. So we have taken up with the town administration's department with the support of Mr. Lakra sir. We have started that. And as far as the dengue is concerned, we noticed in the first week of October there is a large number of dengue cases coming from certain sectors, maybe sector 11, 12 or something like that. So immediately we, along with the town administration's support, we went into those sectors. We saw that where all the breeding points for the mosquitoes are there, and the houses from where the patients have been reported here. So we sanitized the whole area and cleared all the water collection points. Thereafter we concentrated with other sectors also. Now as of now, we have either no cases or very minimum negligible cases from the township per se, but we are getting more cases from around the township areas like Odlapudi, Agnampudi, Kurmanpalam, which falls into GVMC area, and there are a lot of open gutters and open drainage are there, and also the sanitation is not as good as our township. So a lot of our employees and our people staying outside the township coming with the dengue positive and getting admitted here. That also we have taken up with GVMC. We have been giving them the data from where the patients are coming in large numbers, and corporator is also working towards that to bring in some sanitation and spraying and fogging in that area. So I think that also will be taken care. So that way I think we are in a safer zone, and whatever facilities we could improve in our VSGH, we are trying to improve it for the sake of the patients coming to the hospital. We are also planning to increase the parking area also. That was one more concern, parking area for the four-wheelers. We are trying to expand the parking area towards the canteen side, So that will be there maybe within the next 1 to 2 months. Like that, small improvements we are developing, and a lot of other system improvement we are trying to bring in terms of medical reimbursement or MOU hospital referral or laboratory referral. We are trying to make everything online so that the processing of the claims and reimbursement become more easier and quick. So this is for the time being. Thank you very much.
Welcome to our YouTube channel. Don't forget to like, subscribe and share the videos.